Chatham is part of one-day rotating strikes across the province with Red Cross workers. They've been in a legal position to strike since March the 23rd. We tried to get negotiations to resolve the issue. However, the issue of travel time is still our main issue that's on the table and that the Red Cross is not addressing. We've also been lobbying the government to get the funding for this. We were in Chatham just a couple weeks ago, met with Pat Hoy, the MPP here, who literally stated that the workers should be paid for their travel time, that it was a matter of fairness, and yet here we are today having to resort to strike action. Even though that these workers are on strike, they're in a very precarious position given the fact that they take care of the elderly in our communities and those in need of home care. So what they are doing is actually, as we are conducting picket lines, strike lines across the province, workers are still servicing their essential clients, what they consider to be people who cannot do without home care on a daily basis. And they're out there doing that and then joining us on the picket lines. It's like no other sector of healthcare. Other sectors within healthcare do not have the right to strike. They're deemed as essential workers. And in this case, clients are deemed as essential, but the workers are not. And they certainly do not want to be on the picket lines today. They'd rather be servicing their clients, but at the same time we have to get the message out that they're not being paid for the traveling they're doing, which is an essential part of their job, and that they have to have the compensation. It's starting to cost them money to go to work.
This is our last resort. We definitely want changes in the home care sector. It's not just with Red Cross, it's everywhere. There's issues of traveling, mileage, there's benefits, there's wages, there's paid sick days, everything. We want some changes.